This 19th of May 2023 has been celebrated as World IBD Day, and the theme for this year is IBD has no age. IBD stands for inflammatory bowel disease. So there are two conditions which comes under IBD, which is inflammatory bowel disease. First and foremost is ulcerative colitis, and the second one is Crohn's disease. If you look at the incidence, the number of cases of IBD in India, they're rapidly increasing in the last 10 years or so. There are various reasons proposed for that. So if you look at 20 years ago, IBD was almost non-existent in India, but it is significantly increasing in the past 10 years. Various causes have been postulated for increasing incidence of IBD. There are genetic factors, there are environmental factors, lifestyle factors, and family history, and a lot of infections have been proposed in the etiology of inflammatory bowel disease. On top of that, there are certain unique factors like transatlantic migration, people who go abroad and come back. The incidence of IBD seems to be higher in this population. So the people with IBD can have children who are at a slightly increased risk of IBD again. So by doing some modifications in the environmental factors and lifestyle factors, one can gain control of IBD in a better way. So there are various lifestyle factors have been proposed. The first and foremost is smoking. Smoking is extremely bad for patients with Crohn's disease. So if you are suffering with Crohn's disease and if you are smoking, whatever the medication you are going to use, it's not going to work. So smoking is a definite stop for IBD patients, especially Crohn's disease patients. In addition to that, eating habits. So eating fast food, oily food with refined oils, and street food, all these are supposed to increase chance of infections and thereby increasing incidence of inflammatory bowel disease. So one has to eat healthy food, more of fruits, vegetables, water, healthy diet, and fresh food is supposed to be helpful for inflammatory bowel disease. And on top of that, regular eating habits, type of food, timing of food, and regular sleeping habits, reducing stress levels, these are all supposed to be helping IBD patients. And sleep is also extremely important, and stress factor is also, controlling stress factor is also extremely important. If you are suffering with IBD and on top of that if you got a lot of stress, IBD can precipitate IBS, irritable bowel syndrome, which is on top of IBD. So these symptoms can be very well controlled with lifestyle modifications. So diet is an extremely important aspect in the management of IBD. So there are two strategies for diet in IBD patients. One is elimination strategy. For example, if you eat any particular food and that is aggravating your symptoms, you identify those food stuff and then avoid it. The second strategy is different diets have been proposed in the treatment of IBD. Example, children suffering with IBD, they may get better with what you call exclusive elemental nutrition. So they go on exclusive elemental nutrition, whereby they'll be just taking the liquid diet for X number of weeks, and that is supposed to improve your IBD symptoms. And adults suffering with IBD, there are different types of diets have been proposed. One is specific carbohydrate diet, second is Mediterranean diet, third is a low inflammatory diet. So different factors have been taken into consideration for improvement of IBD symptoms. So if you are suffering with IBD, consult your local gastroenterologist who specializes in IBD, and also a dietitian who has special expertise in the treatment of inflammatory bowel disease, and get good gain and good control of your IBD.